Hey everyone, so in this video we're going to talk about spinal segmental coordination, and more specifically we're going to talk about the interaction or the coordination between the three key bony segmental regions of the midline structure, and those are the head, the rib cage and the pelvis. From an IKM perspective, what we tend to try and do early on is separate the body as a whole into three key body regions and consider those body regions' behavior within the context of managing and generating forces. So when it comes to the midline versus the upper limb and lower limb, the midline body region is not necessarily in direct contact with the external forces from the external environment that are impacting our system. The limbs are. So one of the key things that we want to try and do early on, especially if we're working with a client with a midline pain experience or a midline limitation, is at least assess, identify, and then work towards facilitating greater coordinated variability between these three bony segments within the midline structure. The reason we look at these bony segments, the pelvis, rib cage, and head, is because if we only looked at the vertebral segmental interactions, it can get very complex. And sometimes if we're only assessing the interactions between each individual vertebrae, it can be difficult to use that objective information to guide exercises, to guide any kind of intervention and progressions upon those interventions. It's much easier to look at the coordination between the bigger bony segments, the pelvis, rib cage, and head. Okay, so we like to separate these from a head and rib cage coordinative standpoint and a rib cage and pelvic coordination standpoint. So let's look at the head and rib cage interaction first. But what we're looking for here is, what we're looking at here is the interaction between these segments in the sagittal plane in a supine position. Okay, so generally, if we're looking at these segmental interactions from a coordinated perspective, if we wanted to try and facilitate greater coordinated variability, we want these segments to have the capacity to move in opposition to one another, to express opposing directional movement behaviors. So when the head flexes, we want the rib cage to have the capacity to extend. And this will naturally occur in a supine position. The same thing in the other sagittal plane direction. So when the head extends, the rib cage will have the capacity to flex. Okay. The rib cage and head will have to express this coordinated behavior in supine to keep the head in contact with the table. So you're going to see that here in this video. So as the head flexes, you're naturally going to see this extension of the rib cage. Okay, as the head extends, you're naturally going to see this flexion of the rib cage. Okay, one of the key reasons for this is because as the rib cage flexes, it's going to flex the lower cervical spine. So in order to keep the occiput on the table, the head will naturally have to extend to maintain that. Otherwise, the head will just come off the table. Okay, now where this becomes important is when we're trying to facilitate certain behaviors around the cervical spine. So let's say, for example, you're trying to facilitate some concentric behavior through the anterior cervical spine, through the cervical flexors or the head flexors. What you want to consider is, how are the rib cage and head interacting with each other? Because if the rib cage is, for example, very flexed and you have a head that's in an extended position, that's going to be very difficult to then facilitate that concentric contractile capacity through these anterior tissues. What you may need to facilitate then is an extension of the rib cage. So when you extend the rib cage, you can see how this will facilitate more of an extension of the lower cervical spine and a flexion of the upper cervical spine to allow the head to come into more flexion. And that will improve or facilitate greater capacity to get some concentric variability into the anterior cervical spine, for example. That's one example of where that's important. The same sagittal plane coordination or interaction is represented here in the second video here between the rib cage and the pelvis. So as the rib cage flexes, the pelvis will naturally extend or express a posterior pelvic tilt. The same thing happens with rib cage extension. As the rib cage extends or as the thoracic spine extends, if you want to look at it that way, the pelvis will flex or anteriorly tilt. So you'll see that here. So as the pelvis flexes, let's bring that back to the start. As the pelvis flexes, you'll naturally see this extension moment at the ribcage and thoracic spine. This will allow for a lengthening or an eccentric behavior through the lumbar flexors, okay, through the abdominals, and more of a shortening behavior through the lumbar extensors. then as the pelvis begins to extend or posteriorly tilt, we're going to see that flexion of the rib cage. This is going to facilitate more of a concentric behavior through the lumbar flexors, and a more of a lengthening or eccentric behavior through the lumbar extensors. Okay. This is important, for example, if you're trying to facilitate a certain behavior through the lumbar extensors. For example, let's say you're trying to facilitate more of a lengthening, eccentric behavior through the lumbar extensors. And let's say you're trying to facilitate an extension of the pelvis, which is important to facilitate that lengthening behavior of the lower lumbar extensors. But if, for example, the client is already expressing an extension of the rib cage or extension of the thoracic spine, it's going to be very difficult to facilitate that full eccentric behavior through the lumbar extensors. Okay, so you need to consider the interaction between both. So within the sagittal plane, these two interacting segments, rib cage and pelvis, that are interacting with each other through the lumbar spinal vertebrae, they will express opposing sagittal plane directions. Okay, this is important for us to work towards facilitating, not in the sense where you're just going to have the client work dynamically through the range here, but to facilitate a certain position of these joint segments to further facilitate a certain contractile behavior through the muscular tissues. Because it's not necessarily just about facilitating a certain coordinative interaction between joint segments, but how well we can actually facilitate a loading capacity into the muscular tissues that connect those interacting segments. Okay, which is very important when it comes to facilitating variability across the midline. We tend to think more so about facilitating kinematic variability between the bony segments, but we often forget about facilitating more kinetic or muscular variability, where the muscular tissues can express variability in their contractile behavior. So in order to facilitate variability from a kinetic standpoint or a muscular standpoint, we need to also consider the variability from a kinematic standpoint or a joint segmental standpoint. And that's why looking at the interaction or the coordination between these midline segmental structures, the rib cage, pelvis, and the head, and how they interact with each other, is very important to work towards facilitating that kinematic variability and kinetic or muscular variability.